Governor Bill Lee made a public appearance in Nashville today, just days after making the controversial statement that, quote, kids don't get sick from COVID-19 on Fox News. The comments have drawn outrage from state Democrats and many doctors. And as state Capitol reporter Gerald Harris explains, efforts to get the governor to clarify what he meant went unanswered today.
A Middle Tennessee doctor is now speaking out against a false claim made by Governor Bill Lee on Fox News Wednesday night when he said kids do not get sick from COVID-19.
If you want to follow the science, you wouldn't have kids in a school wearing masks when kids do not get sick from COVID.
According to data provided by the state's health department, nearly 160,000 cases have been reported among young Tennesseans, and 10 deaths have been reported in the newborn to 20 years old age group.
Aware that there is an inflammatory condition that can occur after COVID in kids. It's not common, but when it happens, it can be very serious. It can be life-threatening.
Dr. Jason Martin, a Sumner County critical care physician, says the governor is politicizing science.
And there are children hospitalized in the state of Tennessee and in Nashville right now, battling for their lives with this post-COVID inflammatory condition.
Lee, who appeared at a Memorial Day celebration Friday morning, attempted to dodge our cameras when we asked him to clarify his Fox News comments.
Governor, would you like to clarify some comments you've made?
I'll be doing it in the mail in the next 5 days.
You don't believe that children get sick from COVID? I'm doing my job.
Ultimately, the governor declined to answer, but his office did send us this statement Thursday, saying in part, over a year's worth of data shows there is little to no risk of children being infected or becoming seriously ill from COVID.
And for the governor to say that kids can't be sick is just 100% false. It's misinformation. So some basic things we can do are keep people who are not vaccinated, which includes children under age 12, socially distanced and masked, to help prevent those few cases that do occur that can end up killing people.
According to the CDC, children under 1 year old and kids with certain underlying conditions may be more likely to have severe illness from COVID-19.
I think the last year has really highlighted the importance of good government and the importance of solid leadership. And I think it's been lacking at the state level.
In Nashville, I'm Gerald Harris.
Now, according to the CDC, children can be infected with the virus that causes COVID-19, get sick from COVID-19, and can spread the virus that causes COVID-19 to others. The agency also reports that kids, like adults, can be asymptomatic and still spread the virus to others.